Hello, everyone, and welcome to our question lab this evening, and our last question lab of 2020. We're happy you're able to join us today. And today's topic is anatomy. Leading our lab again this evening is Dr. Paras Vakarian, and he's going to introduce himself now.
Hey guys, thank you, Sean. My name is Paras. I'm a dermatology resident at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in St. Louis, Missouri, and then went back home to Michigan to do medical school. I've worked with USMLE-Rx as an RX coach, working one-on-one with students to help them prepare for the USMLE Step 1 and USMLE Step 2, CK. And I'm happy to help lead tonight's last session of 2020.
Excellent, and we're happy to have you here. We have some wonderful panelists joining us this evening. We have Kate, who you'll meet later. She will be conducting our raffle, so make sure you stick around because we will have one lucky winner that'll get a very valuable prize. And we also have a very special offer for you that are in attendance today. Our panelist tonight is Alec. And Alec, you want to introduce yourself?
Hey everyone, my name is Alec. I'm a fourth year medical student at Cooper Medical School in Camden, New Jersey. I'm applying to orthopedics and I've been with RX now for about 6 months. I used it as a student, so I was really excited to come on board and be a tutor as well.
Excellent. Thank you very much, Alec, and we're happy to have you here with us this evening. My name is Sean, and I've been with RX Coach for about 2 years. RX Coach is our coaching and tutoring program, which we'll talk a little bit more about later. But you should know that our panelists are here to help answer your questions. So if you look at your GoToWebinar control panel, you will see a question box, and you can ask questions to our panelists, and they'll do their very best to try to answer your questions. So feel free to ask away there. You've had a chance to meet us. We would like to meet you. So I'm going to ask all of you a question, and please let us know, who are you? We'll give all of you a few seconds to respond. And once about 2/3 of you have responded, we'll move on. And that's what we will be doing with all of our questions this evening. It'll be in the same format as well. So make sure if this is your first time, you can familiarize yourself with this now. If this is your first time joining us for a question lab, please let us know in the question box. We'd love to hear from you. All right, and let's see who is in the audience this evening. And once again, it looks like we have a pretty heavy international medical student and US Canadian IMGs as well as MD and DO students from the US and Canada. So we're happy to have all of you here this evening. As I mentioned, RX Coach is our tutoring and coaching program. We'll talk more about that later. But what you should know as we get into our first of 4 questions this evening on the topic of anatomy is that we will be employing the RX Coach methodology and approach to questions. The first step of that approach is to cover up your answer choices. And as you can see, I've gone ahead and covered those up for you now. The reason we do that is because we do not want the answer choices to guide or dictate your thought process, and we do not want the answer choices to make you panic or anxious if you see an answer choice that you are unfamiliar with. So the first step is to remove those. And then after that, what we do is read the lead-in, which is the last sentence or the question itself. So let's do that now. Histopathology of the site would most likely show which of the following. And once we read the lead-in, we like to ask our students how many steps they think this question will require. Is it a 1-step, a 2-step, or a 3-step question? And the reason we do that is because we want our students to have an organized thought process to make sure that they're not missing any steps and that they are in fact answering the right question. Another reason why we read the lead-in first is because we want you to know what the question is asking. This way, when you're reading the stem in the vignette, you can pick up on those relevant clues right away and avoid having to reread that question on test day and waste valuable time. So we've read the lead-in. Let's go ahead and read the vignette. A 78-year-old man comes to the doctor after a 3-day history of crampy lower left quadrant abdominal pain, accompanied by diarrhea and slight fever. He reports that there was a small amount of blood in his stool earlier in the day, but denies any long-term bleeding. His BMI is 31. He has chronic constipation and takes a daily stool softener. Family history is negative for colon cancer. On examination, he has a temperature of 38.2 Celsius or 100.7 Fahrenheit and non-radiating tenderness in the left lower quadrant. Laboratory studies reveal a leukocyte count of 14,000, a hematocrit level of 35%, and a platelet count of 250,000. Contrast enhanced CT of the abdomen shows a thickened, enhancing colonic wall and pericolic fat stranding. Histopathology of the site would most likely show which of the following. I want all of you to start thinking about the important clues in this vignette as I turn it over to Paris. Paris.
Thank you, Sean. So we'll go ahead and show you what we think are the important clues in the vignette and the lead-in. So first and foremost, demographics. So knowing the gender, the sex, and the age will tell you a lot about what kind of diseases you should be thinking of. We know that he has certain symptoms and signs that he's presenting with that Sean had mentioned, and we highlighted which ones we think are important there. Importantly, anytime you see blood in the stool, that's obviously a red flag, so you should always be wary of that. We do also know that he has chronic constipation, and they do tell us a little bit about his family history. You should always be looking out for that whenever you see blood in the stool. They also gave us some important lab findings and vital signs, so fever, a white blood cell count, and we also have some tenderness in that left lower quadrant. They also were nice enough to give us some CT findings, and we'll talk about that a little bit later. So that's what we think in this question were the important clues, and hopefully you guys agree. So when we look at this actual lead in the actual question, we can tell that this is looking for histopathology. So what would that show? And so in terms of how many steps do we think this question is, I think probably maybe a two-step question. I think one, we need to know what is going on with this patient. What is a diagnosis? And then based off that diagnosis, what would you see on histopathology? So maybe a nice two-step question here. So immediately, hopefully you guys are already starting to think of diagnoses, but then you're taking it a step further to start thinking about what would you maybe see on pathology. So let's take a look at those answer choices and see what we're working with. So we're going to start with answer choice E and work our way up to answer choice A. And the reason we do this is because sometimes we'll see students start at the top and then they'll work their way down, and then they'll see something they like, an answer choice they like, and they'll pick it and select it without having read through all of the answer choices. So we recommend actually starting at the bottom and working your way upward, and this ensures that you don't bias yourself and you see all of the answer choices. So I'll go ahead and do that now. Answer choice E, lymphoid tissue in mucosa. D, invaginated mesenteric tissue. C, intramural inflammation and crypt abscesses. B, focal weakening of muscularis propria. And A, dilated submucosal varices. So we'll go ahead and open up that poll. Go ahead and select the answer choice that you think is most correct here, and we'll talk about it in just a few seconds.
Excellent, thank you, Paris. So we'll give all of you a few seconds here to respond, and once about 2/3 of you have responded, we'll go ahead and see what all of you selected and unveil the correct answer choice. And then of course, we will go over the correct and incorrect answer choices. Once again, for those of you just joining us, please keep in mind that we do have a raffle, and one of you will be a lucky winner this evening, and we have a special offer as well. We'll give all of you a few seconds here to respond. And we'll wait till about 2/3 of you have responded, like I said. All right, let's take a look and see what you selected. And it looks like 52% of you picked C, intramural inflammation and crypt abscesses. And in second place was focal weakening of muscularis propria, and 31% of you selected that. So let's see what the correct answer is. And the correct answer is B, and 31% of you got it correct. For those of you who didn't, don't worry. Boris is going to explain it to you now.
Thank you, Sean. Great job, guys. So let's talk about this question. So first, Sean has gone and pulled up a table here talking about diverticula of the GI tract. And if you look at that first row where it talks about diverticulum, that is a blind pouch that protrudes from the GI tract, and it communicates with the lumen of the gut. Okay, as you can see there, false diverticulum in that second column are only where you have mucosa and submucosa outpouch, and they occur especially where the vasa recti perforate the muscularis externa, which is the same thing as the muscularis propria. So those are the weak points near the muscularis propria where that vasa recta perforate through there. So now that we know that's a weak point for false diverticulum, now let's look at that third row that talks about diverticulitis. We'll see that diverticulitis is inflammation of those diverticula. Furthermore, you get a little bit of wall thickening, and you can see that in that third radiograph there, that it looks a little bit thicker. Obviously, you can get left lower quadrant pain. That's the most common presentation, with fever and elevated white blood cell counts. And so you can get some complications. We won't talk about that for this question, but those are obviously important to know. And treatment would be with antibiotics and IV fluids and bowel rest. So let's take a look now, going back to our question. So this patient had left lower quadrant pain. He had diarrhea, he had a fever, and he also had an elevated white blood cell count. Furthermore, the CT shows a thickened colonic wall. So all of these things are pointing to diverticulitis. And as we just talked about, diverticulitis is inflammation of that diverticula, which is where you occur at focal areas of weakness in the muscularis propria layer. So that's why answer choice B is the best answer here. Let's talk about the other answer choices though, why those are incorrect and what diagnoses those are actually getting at. So answer choice E, lymphoid tissue in the mucosa, that's something that you can maybe see in appendicitis. Overgrowth of lymphoid tissue can sometimes cause appendicitis. Now keep in mind that's often more times in younger patients, and that would usually be right lower quadrant pain or periumbilical pain. Not kind of the picture that you'd be thinking of in this patient. Answer choice D, invaginated mesenteric tissue. So this is likely getting at intussusception, and that's when one segment of tissue kind of telescopes into the neighboring section. Usually we see this in infants and young children, and they have what's called colicky abdominal pain, vomiting, and you can sometimes actually palpate a mass on physical exam in the upper quadrant of the abdomen. We're not really seeing that, and furthermore, imaging may sometimes show that target sign or some sort of telescoping, not that thickened colonic wall which we're seeing here. So that's likely incorrect as well. Answer choice C, this is getting at ulcerative colitis, so type of inflammatory bowel disease, where you have intramural inflammation and crypt abscesses. Now this is different than Crohn's disease, where you have transmural inflammation, but you do have skip lesions as well. IBD would be more chronic condition rather than this patient's acute condition of just 3-day history. The patient would likely not also have the other findings that are mentioned there as well. And then lastly, answer choice A, dilated submucosal varices. Those are possibly getting at hemorrhoids actually. So with hemorrhoids, you could get some blood in the stool, but you would have other things as well. You wouldn't have the fever, you wouldn't have leukocytosis. You really shouldn't have abdominal pain as well. So the clinical presentation is not consistent with just hemorrhoids. In this answer choice, diverticulitis is a disease, and what you would see in pathology would be answer choice B.
Excellent. Thank you, Paris. And for those of you who still want more help with this, of course, you can use our resources, but keep in mind that next week, our topic will be GI physiology. So make sure you tune in next Tuesday at 8 p.m. for our lab on GI physiology. So great job to those of you who got it right. For those of you who didn't, don't worry, you're going to get it right on test day. Let's go ahead and move on now to our second question of the evening. Once again, the answer choices are covered up. And for those of you just joining us, we do that by design. We do not want the answer choices to guide or dictate your thought process. And then we read the lead-in. So here we go. Which of the following best describes how this structure traverses the diaphragm? And after that, we like to ask our students how many steps they think this question will require. The reason we do that is because we want you to have an organized thought process. Is it a one-step question, a two-step question, or a three-step question? That helps ensure that you're going to answer the right question and not miss any steps. But by reading the lead-in first, you will also know what the question is asking so that while you're reading the vignette, you can pick up on relevant clues without having to reread that vignette. So go ahead and take a few seconds and let us know in the question box how many steps you think this question will require. I see some of our veterans have already started doing that, so let's go ahead and read the vignette. A woman at 32 weeks gestation presents for a routine prenatal visit. After exploring options for a birth plan, she mentions to her obstetrician that she becomes dizzy whenever she lies on her back. Her blood pressure is recorded at 118/78, and urine dipstick shows no abnormality. She is told to sleep on her left side instead of her back to avoid compression of a structure in her abdomen. Which of the following best describes how this structure traverses the diaphragm? I'll give all of you a few seconds to start thinking about the important clues in this vignette as I hand it back off to Paris.
Thank you, Sean. So we'll go ahead and show you what we think are the important clues in the vignette and the lead-in. So obviously, importantly, this is a woman, and they tell us that she's at 32 weeks gestation. So we're dealing with a reproductive or more so an OB-GYN question. Her main symptom is that she gets dizzy when she lies on her back, and the physician told her to sleep on her left side to avoid compression of a structure. I highlighted a couple other things in there, blood pressure and urine dipstick. We'll talk about why those are important later on, but mainly we're talking about avoiding compression of a structure. So the lead-in then asks, which of the following best describes how that structure traverses the diaphragm? So, okay, how many steps do we think this question is? One, I think we need to figure out what that structure is, and then two, we need to know how it traverses the diaphragm. So probably a nice two-step question again. So the important thing there is where does the structure traverse the diaphragm? So let's take a look at those answer choices, see what we're working with. And once again, I will start at the bottom and work my way up. So answer choice E, travels alongside the vagus nerve. D, travels alongside the thoracic duct. C, passes under the median arcuate ligament. And B, passes under the lateral arcuate ligament. A, passes through the central tendon of the diaphragm. So you could also argue that some of this may even be a three-step question, because you may also need to know, now that we've looked at the answer choices, what other structures travel alongside the structure in question. So maybe a 2 to 3 step question here. So we'll go ahead and open up that poll. Go ahead and select the answer choice that you think is the most correct answer here, and we'll talk about it in just a few seconds.
All right, thank you, Paris. The poll is open. We'll wait until about 2/3 of you have responded. We'll give all of you a few seconds here. I know that anatomy can give students some trouble, and that's due mainly to the fact that they haven't looked at it in a while, right? You probably learned it at the beginning of medical school and then you pushed it aside. But that's why we do these labs, to make sure that you're staying on top of it, but you're also, having a consistent approach to questions. And we'll talk a little bit about how our program can help you on an individual basis here in just a little bit. All right, a few more seconds here. All right, let's see what all of you selected. And it looks like in first place with 39% was answer choice A, passes through the central tendon of the diaphragm. And in second place with 21% of you selecting the answer was D, travels alongside the thoracic duct. So let's see what the correct answer is. And the correct answer is A, passes through the central tendon of the diaphragm. So well done to those of you who got it right. But let's make sure you got it right for the right reasons. And for those of you who didn't, don't worry, you'll get it right on test day if you pay attention to Paris now.
Thank you, Sean. So great job with this question, guys. So let's go back to the vignette and see what this patient was presenting with. So she was presenting with dizziness and feeling lightheaded. And this is likely due to compression of the inferior vena cava. And that's suggested because it's only present when she's lying on her back, and they tell her to sleep on the left side. So oftentimes this is caused by a tumor, or this is caused by a gravid uterus, which is the likely case in this patient. And it can cause transient hypotension. So pregnant women in the third trimester are told often to lie in what's called the left lateral recumbent position, rather than being completely supine, to decrease compression of the IVC. So that is the structure in question, and that passes through the central tendon of the diaphragm. Now on the next slide, Sean has actually pulled up a table that kind of summarizes a lot of the high yield things about what passes through the diaphragm, what level, things like that. And you can see that there's a nice mnemonic there. I ate 10 eggs at 12. And that will help you in terms of remembering which structures pass through the diaphragm and at what level, what thoracic level do they do that. So we'll stay on this slide, but I'll go ahead and review the other answer choices and why those were incorrect. So answer choice E was travels alongside the vagus nerve. Now you can see the thing that travels alongside the vagus nerve at T10 is the esophagus. And that wasn't really an issue with this patient. We didn't have any issues swallowing, regurgitation, things like that. So esophagus was not the issue, not the structure being compressed. Travels alongside the thoracic duct. We can see there are a couple things that travel at T12 alongside the thoracic duct. That's the aorta and the azygos vein at T12. Those were both not what was being involved in this question. And so those are also incorrect, but it's important to know that both the aorta, azygos vein, and thoracic duct perforate through the diaphragm at T12. Answer choice C was passes under the median arcuate ligament, and that is also the aorta. The aorta passes under the median arcuate ligament. And there's nothing really that shows signs of compression of the aorta, because if you had compression of the aorta, you would be worried about distal perfusion of the extremities. So is this patient having ischemia or necrosis of the feet? And this patient was not, or we were not told that. So aortic compression is unlikely here. And then lastly, passes under the lateral arcuate ligament. No major vessels pass through that, so that's kind of just a distractor. So it's important to know all these different diaphragm structures, what they travel with, what level they perforate, and also what they perforate through in the diaphragm itself.
Excellent. Thank you, Paris. So another challenging question, but hopefully y'all learn from it, and we'll do better on our next question. So with that, I do want to ask all of you a question, and the question is simple, but it's one of the questions that students don't like to answer during these question labs for some reason. Keep in mind that the answer choices are completely anonymous, and we ask you this for a reason. We are going to wait until about 2/3 of you have responded, so the quicker you do it, the quicker we can move on. And the question is simple. How would you describe the results you are seeing after your study sessions? Select one of the following. A, I'm seeing great results and I'm happy. The results don't match my efforts. I'm plateauing, or I'm spending too much time and falling behind. So once again, I see the responses are coming in really slowly for this question, but that's okay. We'll give all of you a few seconds. And then we'll talk a little bit about RX Coach before we move on to our last two questions of the evening. All right, a few more seconds here. All right, let's see what all of you selected. So about 29% of you are seeing great results and you're happy, and we're happy for you. But it looks like a majority of you aren't. A lot of you are saying the results don't match your efforts, you're plateauing, or you're spending too much time and falling behind. You know, one of the keys to being successful as a medical student, whether you're in school or whether you're studying for your board exams, or you're in dedicated, or you've already graduated, is being honest with where you are and where you want to be, right? So if you aren't where you want to be, if you answered B, C, or D, or if you are happy but you want to do even better, RX Coach can help you. What we do is we work with you on an individual basis to make sure that we identify your strengths and weaknesses. We hear time and time again, oh, my friend did this, or my friend said to do this, or I read this on Reddit, or I read this online. And that's great, and we admire your efforts of doing research and seeking advice. And sometimes that might be helpful, but keep in mind that everybody is different. All of your classmates are different. You have different strengths and weaknesses. You have different learning styles. You have different ways of thinking and applying what you've learned. So if you're studying on your own and you're trying to figure out what the best approach is for you, we can help you take that guesswork out by working with you on an individual basis using one of our wonderful coaches like Boris or like Alec or many of our other certified RX coaches to administer that assessment, to look at that assessment. And we are one of the only tutoring companies, if not the only tutoring company and coaching company that's created their own assessment and a variety of resources that's been around for almost 30 years now. The new version of First Aid is coming out at the end of the month. So if you want that edge, reach out to us at rx-coach.com. Set up a free consultation so we can talk to you about the program and how it can benefit you. You will work with the coach on a one-on-one basis to identify your strengths and weaknesses. They'll identify patterns to see what your knowledge gaps are. They'll also work with you to see if you have any test-taking deficiencies and address those. And students who come to us tell us two things. The first thing they say is, my studying has become much more efficient. So they're seeing results quicker and they're able to accomplish their goals, which is why, as you can see, our student satisfaction right now has increased from what's listed on our website, which is a 4.82 to a 4.9. And that's a true testament and a great testament to the wonderful work all of our coaches are doing. So, it's a very important exam as you begin to get into the new year and start to plan for the future. Please keep in mind that sometimes, these investments in your future pay for themselves, and getting that score is going to certainly pay for themselves. So visit us at rx-coach.com if you want to talk about the program and how it can benefit you. Click on that free consultation tab and you and I can have a discussion. All right, so let's go ahead and move on now to our third question of the evening. Once again, the answer choices are covered up, and we will begin by reading the leading. Rupture of which of the following structures is most likely the source of injury in this patient? Rupture of which of the following structures is most likely the source of injury in this patient? We'll give all of you a few seconds here to respond and let us know how many steps you think this question will require. All right, I see the responses coming in. Let's go ahead and read that vignette. A 15-year-old boy is brought to the emergency department because of severe growing pain after a skateboarding accident. He says he was riding his skateboard down a horizontal rail when the board slipped and he fell straddling the rail. He is afebrile, tachycardic, and unable to void. Genital examination is significant for blood at the urethral meatus and marked bilateral scrotal swelling. Rupture of which of the following structures is most likely the source of injury in this patient? I want all of you to start thinking about the important clues in this vignette as I hand it back to Boris.
Thank you, Sean. So once again, we'll go ahead and show you what we think are the important clues in this vignette and this lead-in. So they give us actually a pediatric case here. So a 15-year-old boy. And then mainly, long story short, he was skateboarding and he fell straddling the rail, okay? We do know that he's not able to void. There's blood at the urethral meatus and there's bilateral scrotal swelling, okay? So then they want to know rupture of what structure is the most likely source of injury, okay? So how many steps is this question? I think this could be a two-step question. Again, I think one, knowing what type of injury this is, and then two, what structure is can be ruptured in that injury type. So I think this could be a two-step question. So let's take a look at those answer choices to see again what we are working with. So answer choice E, prostatic urethra. D, penile urethra. C, membranous urethra. B, bulbous urethra. And lastly, A, anterior bladder wall. So we'll go ahead and open up that poll. Go ahead and select the answer choice you think is the correct answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Para. So our third question of the evening will give you a few seconds here to respond, and then we'll see what the correct answer is. Keep in mind that you should stick around until the end because we do have a raffle, and one of you attendees will be the lucky winner of a valuable prize. We also have a special offer we will discuss and reveal at the end here. If you want to mark your calendars, we do have a Secrets of the USMLE webinar coming up in January. And the date for that is going to be January 18th. And the topic is going to be communications. And that'll be with Dr. Tao Lee, the senior editor of First Aid, and Dr. Faris Vakaria, who you have met today. And we'll be covering communications as we are launching new communication questions in our questions bank. So that will be a really nice treat. All right, let's see what you selected. And it looks like 41% of you selected C, membranous urethra, and in second place was bulbous urethra. So let's see what the correct answer is. And the correct answer is B, bulbous urethra, and 34% of you got it right. And I will tell you, a lot of students come to us and say, oh, I knew that, but I didn't get it right. And if you keep telling yourself, oh, I knew that, that's probably a test taking deficiency. And most, if not all, USMLE programs don't really address individual test taking skills. And we do that here at RX Coach. So make sure you reach out to us. And with that, I'll turn it over to Paris.
Thank you, Sean. So this is definitely one of the tougher concepts of the Step 1 material. So here's a diagram or a picture of the different segments of the urethra, just so we have our anatomy in mind as we start to explain this question. So you can see there, most distally, obviously, is the penile urethra. And then as you extend more proximately, you see the bulbar urethra or bulbous urethra, and then the membranous urethra, and then the prostatic urethra as it passes through the prostate, and then basically reaches the end of the bladder at that point. So those are the main four types of the urethral components. So let's take a look at our vignette again. So we know that this 15-year-old kiddo fell basically what's considered a straddle injury. We know that he has swelling of the scrotum bilaterally and blood at the urethral meatus. So straddle injuries such as this one can often damage the urethra, specifically the bulbous urethra. Straddle injuries oftentimes increase your rupture risk of the bulbous urethra, okay? And that occurs because of crushing injuries to the perineum. And if we can actually go back to that picture, the first picture, hopefully you can see where that bulbous urethra sits, just how if this person were to fall directly onto something like a railing, just how compromised that bulbar urethra would be. So hopefully this anatomic, this image shows you anatomically just why the bulbous urethra is such at risk of what's called straddle injuries. So when you have this type of injury, urine can flow into the scrotum, and that's why this patient has bilateral scrotal swelling. And this leads to the patient's inability to void as well, okay? So now let's take a look at the other answer choices and why those are incorrect. So prostatic urethra. So this rupture, as you can imagine, actually is not too commonly ruptured, and that's because it's kind of a little bit protected by that prostate gland. If it were to be ruptured, it would be an improper catheter that was placed or a fractured pelvis, not what we have going on here. Penile urethra, this would be following a penetrating injury. So if something were to directly penetrate into the urethra. A membranous urethral rupture, I can see why a lot of you selected this answer choice because this actually is the weakest point of attachment. However, the type of injury where you get damage to this is also high velocity pelvic fracture. So if this patient were to have a high velocity pelvic fracture, such as from a car accident, that would be something you could consider. In answer choice A, anterior bladder wall, this is also typically caused by a fractured pelvis, but in this type of injury, urine will flow into the retropubic space rather than into the scrotum, as we saw in this patient. And actually on the next slide, Sean has actually gone ahead and showed, pulled up another table comparing the types of urethral injuries. And you can see our type of case was an anterior urethral injury, bulbar urethral injuries. You can see there, straddle injury is the most common mechanism that causes that. You can see that you get scrotal swelling is evident by that picture right below that column. And you can also have blood at the urethral meatus. However, that is not specific. The membranous urethra, which is part of the, which is more on the posterior or proximal side of the urethra, as you can see there, commonly is due to pelvic fractures. So different mechanism, and that's why bulbous urethra was the best answer choice in this question.
Excellent. Thank you, Paris. And yet another challenging question. Let's move on now to our last question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Occlusion of which of the following vessels would most likely produce these symptoms? Let's read that vignette. An 80-year-old man reports that he occasionally passes out. He states that this only occurs when he tilts his head back. He has a 50-pack year smoking history, well-controlled diabetes and hypertension. He denies alcohol or drug use. He has had a left carotid endarterectomy, as well as surgical repair of an abdominal aortic aneurysm several years ago. The physician informs him that as people age, their risk for atherosclerosis increases. The physician tells the patient that he is likely experiencing transient brainstem ischemia when he extends his neck. Occlusion of which of the following vessels would most likely produce these symptoms? I'll let all of you start thinking about the important clues and how many steps this question requires as I hand it off to Paris.
Thank you, Sean. So once again, we'll go ahead and show you what we think are the important clues in this vignette and the lead-in. So again, demographics. This is an elderly male, 80-year-old man, and he's occasionally passing out, especially when he tilts his head back. So they gave us a lot of past medical history here. He's a smoker, he's diabetic, hypertensive. He's had a couple surgeries, a left carotid endarterectomy and an abdominal aortic aneurysm. And then the physician also tells him a couple things. Whenever I see that, whenever I see in the actual vignette, the physician telling the patient something, that's often going to be very important to what's going on in the question, because you really don't need that for a clinical diagnosis. So why in this question stem are they telling you the physician is of specifically something specific that the physician told that patient? So I always think that's very important. So we have a couple things there that the physician told the patient. So then the question is asking us, what vessel would be occluded that would produce these symptoms? So I think in terms of how many steps this question is, I think this could maybe be a two-step question. I think one, figuring out what is going on here exactly in this question, maybe what's a diagnosis of sorts, and then two, what would be occluded in that diagnosis. So I think, again, maybe a two-step question. So let's take a look at those answer choices. And once again, we'll start at the bottom and work our way up. Answer choice E, subclavian arteries. D, internal carotid arteries. C, external carotid arteries. B, anterior spinal artery. And A, anterior intercostal arteries. So we'll go ahead and open up that poll. Go ahead and select the answer choice that you think is the best answer, the most correct answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paris. So this is our last question of the evening. Let's try to finish strong. Anatomy, especially neuroanatomy and blood supply, can be quite challenging, but it is high yield. And I'll show you in just a little bit a resource you can use to really master that subject. So we'll give all of you a few seconds here to respond. All right, about half of you have voted. Let's give you a few more seconds here. I know it's a challenging question, but it is important. All right, and let's see how you did. And 41% of you selected internal carotid arteries and 24% of you selected anterior spinal artery. Let's see what the correct answer is. And the correct answer is E, subclavian arteries, and 17% of you got it right. But don't worry, it is a hard question, and we're going to explain it to you now. Boris.
Thank you, Sean. Yeah, it's definitely a tough question, but definitely one that's important to know. So let's talk about it. So you can see here that the whole main gist of this vignette is atherosclerosis, right? The physician is telling him that his risk of it is increased as they age. He's diabetic, hypertensive, he's a smoker. He had a carotid endarterectomy done to clean out his carotids because of atherosclerosis. He had an abdominal, a AAA surgery, probably also because of atherosclerosis and smoking as well. So a lot of atherosclerosis going on here. So that's really what would be going on in theory in this vessel. So what's going on is you can get atherosclerosis of the vertebral arteries, and the vertebral arteries are the first branches of the subclavian artery. And so this is a phenomenon called the subclavian steal syndrome. So basically, you can see that there's a little bit of atherosclerotic disease in that left subclavian artery, okay? So when you have a blockage, such as by atherosclerosis, what's gonna happen is it's that the left subclavian artery is not getting enough blood from the aortic branch. So it needs to figure out another way to get that blood. And what ends up happening is that blood flows down the left vertebral artery into the subclavian arteries. You can see there by those red arrows going downward in that left vertebral artery. Normally, blood should be going upward in both of the vertebral arteries as they form and fuse to become the basilar artery, which will provide blood supply to the brain. However, if you are stealing blood from the vertebral artery, so it can go into the subclavian artery because of that blockage, you can thus have episodes of passing out, especially when you extend your neck, and also if you are to exercise your arm a lot in the arm that has that atherosclerosis. So let's say you have atherosclerotic disease in the left subclavian artery. If I am doing a lot of bicep curls with my left arm, then I can also start to get these episodes of passing out because my arm is going to try to steal blood that was intended for the brain. That's called subclavian steal syndrome because the subclavian is stealing blood that was meant for the brain. So it's a difficult concept, but it's very important. And again, the classic times this happens are when you are extending your neck or when you are exercising the arm of the affected side. So we'll briefly talk about the other answer choices and why those are incorrect. Internal carotid arteries, both, and actually the external, both of those, if there were to be occlusion of both of those, it wouldn't really lead to the episodes of loss of consciousness. It would lead to other, a wide variety of other signs and symptoms, not what this patient has. Anterior spinal artery, this supplies the anterior portion of the spinal cord, and there's actually a specific type of spinal cord stroke syndrome. If you guys remember, that's due to ASA occlusion or injury, and then which is different than what's going on here. And then anterior intercostal arteries, these supply some of the intercostal spaces, and again, not really relevant to what's going on here. So this is a good example of subclavian steal syndrome, where you have occlusion due to atherosclerosis of the subclavians causing passing out or brief episodes of loss of consciousness.
Excellent. Thank you so much, Boris. I want to also take this moment before I hand it off to Kate to thank all of you for attending our question labs this year and being so supportive. Please let us know in the question box, what you like about question labs, if you have any topic suggestions you'd like us to cover. And of course, to all of our wonderful coaches and panelists and Kate and Jeff for always being here to help us out. So stick around for the raffle. I want to show you something else real quick before we do the raffle, and that is this. That was a tough question, and many of us got it wrong, and that's okay. Failure is a part of learning. But if you look here, this is our brick on cerebellum structure and function. And we have one on blood supply as well. So this is in our neurology section of bricks. And as you can see, we start off with learning objectives. And then we have a nice little case connection here for you. We talk about what is the cerebellum. We scroll down. And you can even see these interactive quizzes where you can start to really see exactly what these images are and be interactive so you're learning in a engaging way. Clinical correlations, more diagrams, flashcards. So it really is an interactive learning module. Mnemonics as well. And as you continue in this interactive module, you will come to the end. And when you get there, you will see the case connection, tying it back to the case connection you saw earlier, and a summary of key points that we want you to take away and learn from this module, as well as practice questions. And once you get the answer right, you will get the explanation. A little in training segment here. You can review the learning objectives to see which ones you're comfortable with. And then you can go deeper. So if you have a lot of resources, you tend to flip around and go back and forth, and it's hard to learn in an organized way when you're not studying in an organized way. So you can go directly into first aid here, our digital version of first aid. You can study with our flashcard system and use space repetition with flashbacks. You can watch express videos, or you can practice with QMax questions. So for those of you who have not yet experienced bricks, we highly recommend you to check them out. We have several free bricks and a free trial for all of RX 360. And as Alec, one of our tutors, mentioned to us earlier, he used it to his success. And I will say he's got some of the highest board scores I have seen. Well done to him. And if it worked for him and so many others, it could probably work for you also. So I highly encourage you to take a look. If you have access to QMax already, these are the 4 question IDs for the questions we did this evening. You can simply go into QMax, type this in the RX search field to review these questions further at your own convenience. So I'll give you a few seconds here to either write those down, take a screenshot, or take a picture.